Hey, I wanted to answer your question about possibly using a nebulizer for your albuterol treatments instead of your regular handheld inhaler. Now, a regular handheld inhaler right here is called an MDI or HFA. And basically that just means there's a propellant in here that pressurizes the canister before you squeeze down on it, and it mists that medication in your mouth and into your lungs. We also have an option to use something called a nebulizer. And a nebulizer is basically a little machine that takes liquid and vibrates it really fast, or nebulizes it, aerosolizes that medication. And if we use a tube and a mask, we can breathe that medicine in over a few minutes. So ultimately, we're delivering the exact same medication, albuterol in this case, into your lung tissues. And for adults who are able to coordinate well enough and use a regular inhaler, the studies show that the effectiveness in terms of treating an asthma symptom or asthma flare-up is the same between a handheld inhaler and a nebulizer. Now, these nebulizer devices, like I have right here, are super helpful in some situations, in children who can't coordinate, or if a person's really, really sick and short of breath and just can't, do that. So we often will use these in the emergency room or in our office when someone comes in and they're really short of breath. But I think for most adults, the regular inhaler works just fine. But you will notice a lot of times when you don't time this perfectly, if you had this up to your lips and you puff and breathe in, that a lot of that gets on your tongue and the back of your mouth. Now, that's not inherently bad or dangerous, but that means some of it is not getting into your lungs. So what I recommend for most people is using a spacer device. And if you aren't already doing this, you should. Because this allows basically a similar effect to the nebulizer, but it's much quicker and easier to do. And you will squirt the inhaler into this plastic clear chamber. And at the very end of this spacer, there's a little one-way flap. And so it gives you a few seconds basically to suspend that medication in aerosolized form in the chamber, and then you breathe it in deeply. And there are studies showing that people more consistently get more of the albuterol deeper into their lungs using the spacer versus this alone. But at the end of the day, either three of these options are going to get albuterol where it needs to go. So in terms of just convenience, I think for most people, a regular inhaler with a spacer is the way to go. But at the end of the day, personal preference. And if you do want a nebulizer to use at home or take it with you for traveling, we can definitely arrange that.